I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Rashiv Bhardwaj for scoring a
Thank you so
remote
much.
rank of 260 in MCH Surgical Group in NEET SS session 2023. Congratulations to you, Doctor.
Thank you so much, sir. Thank you so much. I am really lucky and honored right now, like sitting in front of you and talking to you. It's very special for me, sir.
Equally honored. I am also feeling the same.
Like I'm following your classes since like last 2 years, but getting this opportunity is really special, sir.
Great, Doctor. Very nice of you. And thanks for your time also spending with us today.
Sir, I was waiting for this.
Doctor, can we know your detailed background from where you started your career till date? What all you have done?
Sir, I had done my MBBS from Karnataka in 2010 batch, that is private institute. And then I joined GMC Jammu Surgery in 2018. And then 2021, I finished my MS and I took 2 years for this. First year, actually first half and 1.5 year, I was doing along with duties. I had joined senior residency in GMC Jammu and that was little hectic for me to continue duties and do this together. But then last year, actually I got a rank of 1100 and I was not happy because I was stuck what to go for. And then I thought, okay, I will give another try. So I left my senior residency 4 months back, and then I gave all the time. Whatever time was there, I gave for this.
What all you did in your preparation, Doctor?
So to be very honest, speed was the first thing in my life. Like from where I got to know so many things. Because after finishing my MS, there was nobody to actually tell me what to do and what not to do. So speed came and then I joined and I started doing your classes, recorded classes initially. But then later I started listening to your daily classes, those weekday classes. So that gave me idea what to start, from where to start. So at some like first 2 3 months, to be honest, I was not very oriented and I was just confused. Like I will read one thing and another day I will read some other thing. So finally, I thought, okay, whatever topics they are teaching me, I will open my books and I just kept simple, nothing else. I will read Bailey and Sebastian. I will read those topics what they are teaching me, and I will just try to read it as many times as possible. So it continued, sir. Especially few people like your classes and Basant sir classes. I think when I joined, I was not sure like which branch I'll go for. Like, and after listening to Basant sir, I was so sure that okay, I have to go for gastrosurgery.
Very nice. So your interest is gastrosurgery.
Yes, sir.
Very good, very good. So how many questions did you attend, Doctor?
Sir, I think 138. I don't remember, more than 135. Sir.
Very good, Doctor. Now, what is the message that you want to give to your juniors or friends for aspiring for MCH?
So I know only one thing: hard work, sir. For me, it's hard work, and you need a platform, sir. It's because I don't think it's possible for a person to go through multiple books, multiple topics, because we don't know what to read. And papers are also not like constant papers. Last year they're asking something else. This year they're asking something else. So it's like you need a mentor, sir, to listen. Like home, you can listen, you can follow classes, and then you read those topics. And definitely, MCQs are the backbone. Like you have to do as many MCQs as possible. I have been doing like endless MCQs. I don't even remember the count. I will just read the topics and do MCQs.
Very nice. So time to thank whom all you want to thank, the people who have helped you in your career to achieve what you are today.
So definitely first my parents and God, because of whom I'm here. And sir, for special mention has to be speed, sir. There are like many teachers, many people, my friends, but I don't think if I have not joined this institute, like I'll be here. And getting a rank of 260, I think, because I felt the exam was very tough. It was
Yes.
not something I have prepared. There were so many unexpected questions, and I could answer all those questions. I think there were some teachings. There were many people standing behind me and telling those answers.
Thank you, doctor, for great words, and Speed faculty members and team will definitely feel happy on listening to your video.
Thank you so much, sir. Thank you so much.
Very nice, doctor. And we once again we wish you all the very best and all the success for a great career as a surgical gastroenterologist in making, and
Thank you.
also as a specialist in serving the people who are coming to you. Once again,
Thank you so
advanced
much.
wishes and best wishes to you.
Thank you so much, sir.
All the best, doctor.